Introducing UDoTest's simple, personal, at-home testing platform. Consumers want convenient healthcare services. Not only that, but they're also looking for more diagnostics in the home. However, with current direct-to-consumer lab tests, doctors are losing control of their patients because they have no access to their data. Not only that, but insurers are also not covering these direct-to-consumer lab tests currently being sold online. Not only that, but also between 20 and 31% of patients do not complete their lab orders when requested by their physician. And last but not least, in 2017, the CDC reported at least 2 million cases of STDs across the country between chlamydia, gonorrhea, and syphilis, this being the highest number ever, amounting to upwards of $16 billion in healthcare costs annually. So, what can labs do to reach more patients, offer physicians value, and increase revenue? Introducing our simple, personal, at-home consumer testing platform that's white-labeled and customized for laboratories. There are 3 parts to our offering. Firstly, the at-home test or the health box, which is essentially the tangible product itself. Secondly, the white-labeled consumer interface, or the rebranded consumer interface, where essentially the consumer engages with the service. Thirdly, it's the back-end management system available for laboratories, which is essentially where everything is centrally managed and tracked. So getting into a little bit more detail, essentially the at-home health box. It uses gold standard validated medical devices. It's designed to test specific population and or disease, and it's at-home specimen collection that goes to a laboratory, essentially including things such as urine collection, swab, toilet water, and most recently microblood collection using our current lab partnerships and validations. Examples of current at-home testing menus have included cancer detection, STDs, diabetes, cholesterol, liver disease, heart disease, kidney disease, inflammation, hormones, and more. But that really does depend on the lab that we integrate with and the type of population that we're serving. Secondly, the white-labeled consumer interface or the rebranded consumer interface. This is essentially where consumers or patients can order their own test from a physician, get results, get follow-ups, and get a customized experience specific to them. So this specific page would be rebranded with the laboratory's corporate identity, logo, brand, etc., and our back-end HIPAA compliant consumer engagement platform would be customized according to the type of test that the consumer has ordered and the type of service required to give them. Last but not least, we have the UDoTest backend management system for laboratories. This is the place where at-home testing is simplified and personalized on behalf of the lab. It is designed for a specific population. This is the part of the platform and service where everything is measured, tracked, as well as outcomes improved. And this is the space that connects the lab to the provider, to the plan, device, and the consumer. This is the management system for everything that we do. There's a guaranteed ROI for laboratories because essentially they're receiving physician orders with our platform. They're having the opportunity to increase revenue because they're receiving more specimens. And essentially our platform is seen as an extension to the laboratory, which goes hand in hand with current physician visits or current phlebotomist visits, where our offering can be seen as an extension to the patient, an additional value add, where essentially the lab can offer more than just a result to their physician too. And we've seen this in examples where physicians value offering this type of at-home service that's customized for them, and it can add value to their patients who perhaps they have not seen this year or recently. And last but not least, reaching more patients, obviously, because all of a sudden the ability to provide that convenience in the home opens up access tremendously. Improving patient experience. So essentially with our easy one-click friendly online consumer experience at home, the customized communication and support that patients will receive, as well as personalized experience based on the type of test that they're ordering and demographic. It's available 24/7 and tracked in real time, so the patient doesn't have to wait for the lab draw facility to be open or wait to schedule an appointment. And then retention and reminder features are built into our platform and service offering. We're obsessed with patient centricity and with tools and features designed with the patient or the consumer in mind, with more innovative features coming, which are really exciting, focusing on that patient. So we've tried to make our platform really easy to launch for labs in that we identify the population and or disease they want to focus on or they validated within their lab at this present point. We then share information and set parameters specific to their outcome needs. Then in terms of launch, we invite the population and physicians to the platform to participate. We launch. UDoTest's can then amplify the communication, track responses, and reiterate if need be. And on an ongoing basis, the labs can access our enterprise data dashboard and obviously track the measured results and improving outcomes as we go. In terms of the consumer process, so to give you an example, a consumer or the patient orders and pays online from a physician. Secondly, there is home delivery to that customer or physician's home. Thirdly, the customer collects a sample and drops it off at FedEx. The sample then goes to the laboratory. And last but not least, the patient receives doctor's feedback, support, referrals, assistance, etc. if required. Then in terms of that patient engagement, so we've made a simple and intuitive consumer ordering process. This is really important to essentially speak the language of the consumer and keep it simple, but give them the information that they want to know. And essentially we customize the ordering process on behalf of the clients and the population we're serving. And then we've got a range of engaging marketing that we've designed and we incorporate specifically for the population and our clients, including things like digital invitations, communication in emailers, digital education, tangible, actual printable education, etc. Then to give you a bit of information on our team, essentially the US executive team, there is Alison Martin, the CEO and founder, been in the healthcare space for 10 years, but also tech space for several years. Amy, human genetic specialists, the co-founder, Anatoly, CTO in Massachusetts, essentially health system experience and complex environment experience. And then advisor board comprising of experts from AHIP, America's Health Insurance Plans, with your health plan members across the country, health systems such as Steward Healthcare, retail and Walmart former executives, as well as one of many phenomenal physicians who are involved in the UDoTest process across the United States. A quick snapshot of some key milestones for the business. So the business was founded in 2013 and received rapid adoption from the United Kingdom 1 year later, and in the United States in 2016. What brought them to the United States was significant awards. One from Genentech in San Francisco in 2016 for the quest to end cervical cancer in the United States, which brought them to Silicon Valley to receive that award. 6 months later, another one from Frost and Sullivan in San Diego, and significant recognition thereafter from Africa's largest health plan called Discovery Health, which brought them to an incubator in Silicon Valley in 2017. Significant developments led the business to becoming a B2B organization, partnering with health plans specifically and other enterprise businesses across the United States since 2018. That brings us to a close. A quick summary of the platform suitable for laboratories to ultimately increase revenue in their lab, engage patients and consumers directly in a whole new way, and ultimately close screening gaps amongst the populations that we serve. Please contact us on the details on this slide, or contact us for any questions you might have associated to this. Thank you so much.